Welcome to our school. And our school, as you know, is an international school, the NPR International School. And today we were talking about something very, very nice topic. That is the T.M.Js. You know, T.M.Js is a difficult topic because, in my opinion, we have a wrong concept regarding the T.M.Js, and I will try to clarify the point of view of our school in the T.M.Js. Right? As you see, it's T.M.J and posture. Why we said posture? We said posture because normally we talk about T.M.Js regarding something local, but our body is connected. We cannot talk about just one part of the body. And also we talk about T.M.Js. T.M.Js is, you know, T.M.Js is just a joint. The correct thing is to talk about the craniofacial system. What means craniofacial system? The whole system, cranial and face and neck. And also, obviously, T.M.Js is part of this system. And this system is connected with the rest of the body. That is the main goal. We have to point. If you don't know me, this is a little CD. I am Professor Di Rocca, and I am the director of the NPR International School. And medical dentist, specialist in postural disease, and I am dealing with temporomandibular disorder for more than 30 years. And I will try to explain today our point of view in our school. NPR, I want to explain you roughly, shortly, what is NPR, myofunctional postural rehabilitation. Myofunctional postural rehabilitation is a method for all medical sciences to see the patient with the same point of view in diagnosis and therapy. And today we will talk about one part of the therapy, that is craniofacial system disorders. The topics for today: the relation and effect of the T.M.Js, the diagnosis. We will talk about treatment, and we talk for something very important, that is prevention. Prevention is really, really important. And as you will see at the end, we can prevent the temporomandibular disorders and the craniofacial disorders and also the postural disorders in the growing age, evolutive age. Okay, we're going directly to the presentation of today. Relation and effect. First topic. As I told you before, when we're talking about T.M.Js, temporomandibular joint, have different functions. Is working into the speech as the jaw, participate in the speech, but also the mastication. You know? All this movement of the jaw is related with muscles, ligaments, but mainly for the occlusion of the teeth. The occlusion of the teeth is a very important part because it's conditionated the position of the T.M.Js, even if it's right or wrong. But it's very important to understand that T.M.Js is not isolated. T.M.Js is part, as I told you before, of the craniofacial system. The craniofacial system have host two of the most important functions in our body, is the central nervous systems and the stomatognathic system. Imagine, craniofacial system, two very important functions in our body. And we talk only about T.M.Js. It's very simple. T.M.Js is a joint, very important joint, but it's part of the craniofacial system, and craniofacial system is part of the body. That's why we say T.M.J and posture. We cannot treat T.M.Js talking about only this particular joint. The craniofacial system is composed by different bones and muscles that they have to work in harmony with the rest of the body. That is a very important concept. We cannot treat only the craniofacial system or the body separated. We have to work together. That's why it's necessary an interdisciplinary approach, just not a dental local approach. The whole bones of the cranium have little movements that we call that craniosacral breathing. The sutures move a little bit, but the jaw, so the lower jaw, is the bone who have more mobility. We can open the mouth very big, right, left, forward, back, but that movement is conditionating when the jaw closes, is conditionated by the teeth. Even if the jaw position is wrong. That's why we said in our school that the most important thing is the jaw position in balance with the rest of the body. The correct function of this system is when we have a good position of the jaw, good mandibular posture. Dentistry talking about this for many, many years. We call that central relationship of the jaw. And we don't know why. But we focus our jaw in the central relationship. But it's very important. Why? Because if jaw is centrated, the temporomandibular joints do not suffer, and it is not disease. That's why it's very important, the jaw position. But also it's very important, the occlusion. And it's very important, the vertical dimension of the jaw. All these things we are talking about have to be in good harmony with the rest of the body. We cannot work in dentistry talking about just teeth, T.M.Js, jaw position, and no more. It's craniofacial system in balance with the rest of the body. That is the concept. In our school, we said our purpose is have a good balance between craniofacial system and a particular system that we call tonic postural system. That is the system who deal with the posture of our body. That means that neuromuscular balance is very important. And when we change the jaw position, it affects the posture. Any change, it is related with postural disease. But how does the T.M.Js affect the posture? How this changing can affect the rest of the body? Someone can say, oh yeah, what happened? The jaw is concentrated, what happened with the rest of the body. But if we understand that all is connected, you will understand why. In posturology, we know very well how the posture is working. This is not the moment to talk about posturology, but just to give you some introduction. The tonic postural system have receivers, have receptors, who send information to the central nervous system. Central nervous system is creating we call the basic muscle tone. One of the main receptor is the oculomotor system, the movement of the eyes. That's very important to understand. Why? Because when the jaw changes position, it's affecting one of these main receptors. And what happens when that jaw is changing the position? How is affected? And if we keep that position chronically through the muscle change, it will affect the foot support, another main receptor of the tonic postural system. Imagine, craniofacial system dysfunction will affect two different main receptors of the posture, eyes and foot. And what is the symptom? Simple, functional scoliosis. Functional scoliosis is not a disease. It's an accommodation of the column when the receptors are not working well and the muscle chains are not in balance. The main change position we have anteposition, retroposition, and lateral deviation. Any one of these is affecting in one way the oculomotor system and also the muscle change. How this situation can affect the eyes? The unilateral changes of the jaw, that means lateral deviation, intrusion of the condyle, is affecting the movement. We call that hypoconvergence. The hypoconvergence is the coordinated movement of the eyes. And you said, what is important? Why is important that? It's very important because when the eyes are not coordinating in the movement, it will affect the peripheral vision. Imagine, that's very important in sport. That's very important when you walk, when you drive. If you don't have peripheral vision, you will adapt the head and you will create neck problem and postural problem. Lateral deviation is affecting only one eye. We call that unilateral hypoconvergence. This is a sample. This is the test we do. Okay? And you see that eye is not working, the right. The forward position or retro position, imagine what I am telling now, right? The retro position, forward position, vertical dimension, all these things are affecting both eyes, bilateral hypoconvergence. Imagine, jaw position affecting the eyes movement and affecting peripheral vision, head adaptation, problem in the posture. This is a test. bilateral, both eyes. What means for the people who is not practicing in posturology, when we said to the patient with a little point, to go and see to look one point starting from 10 centimeters from the nose to the central nose, the oculomotor system is allowed to keep the position for 15 seconds. After that, it's tired. But if it's not allowed to keep the position for 15 seconds, we call that hypoconvergence. Very difficult to explain that in one conference like this. But imagine, this is the mechanisms. I will show you 3 cases. That was a research I did in 1990, testing the jaw position, the oculomotor system, and the posture with an instrument. First case, mandibular deviation to the left hypoconvergence, and we see the readings of the posturometer. Look at here. Left lateral deviation affecting that eyes. Anytime we change the position to one side or to the other, is affecting one side of the muscle change. It's creating overloading to one side, to the left or to the right. Lateral deviation affecting one side of our body. And look at here. Mouse open, 1 kilo of overload to the right. When the patients close the mouse, it's increasing to 5.2 kilos to the right. Second case, mandibular deviation to the right eyes hypoconvergence, and we see the reading. Look at here. Deviation to the right eye is affected, and look at here also. 3 kilos to 4. Always when the jaw is changing laterally, it's creating overload. That's why I am saying you cannot work as a dentist just looking the jaw. And look at here, third case, mandibular forward position. We have bilateral hypoconvergence, and look at the reading. Forward position, bilateral hypoconvergence, but look at here, no overload. When the jaw is forward or back, we do not have overload to the side, but we have movement to the barycenter, forward or back. The barycenter is changed. And look at here. Can you guess the jaw position? Unilateral hypoconvergence, lateral deviation. You see that? Unilateral. Lateral deviation here. As you see, it's repetitive. When I did the research, I was surprised, very surprised, because nobody is like this. We don't have repetition like this in medicine. But anytime I measured that, 1990 was repeated. Roughly 95% of the patients we measured. Bilateral. Look at here. Forward position, crossbite. And how does the eyes affect the posture? We do now a review. Lateral deviation of the jaw affects the eyes mobility. This generates stress in the body's muscle change and is creating alteration in the posture. And that's the schema we saw before. Lateral deviation, unilateral hypoconvergence. Forward, retroposition, bilateral hypoconvergence. When we have lateral deviation, only we affect one side of the body. When we have forward or retroposition, we affect in sagittal way. That's very important for diagnosis and also for treatment. And how does it affect the muscle chain? Because you say, okay, lateral deviation is in lateral deviation. How is it affecting the muscle chain? Very simple. You will see now. We have a connection between the upper part of the body, craniofacial system, and the rest of the body. It's the hyoides system. When the jaw position is changing, we were talking about bruxisms. We think bruxism is a stress. It's a very wrong misconcept. Bruxism is a defense that central nervous system have to protect T.M.Js. And you say, why? Wow, what is that? No? Yes, it is a very bad system. But this is the basic protection. Immediately, when central nervous system, imagine that is increasing the pressure here, because we know very well that the increasing of the pressure into the T.M.Js is creating disease. Central nervous system said, who is blocking the situation? Teeth. Go ahead, destroy the teeth. First intervention. Very bad intervention. Very bad defense. That is creating muscle hyperactivity. Cranial, muscle systems, neck system, and slowly going down into the foot. And chronic postural alteration. Imagine, a natural defense can be a very wrong defense with that action. When the jaw changes position, normally is changing the pressure inside the joints, and we have there very important proprioception. When increasing the pressure inside, start the alarm, proprioceptive alarm. What is the defense? Natural defense, bruxisms. Very bad defense. To protect one important part of the joint, what is the retro area, what is arriving all nutrition. And central nervous system know very well that in that area is dangerous if it's increasing the pressure. Immediately the action is bruxism, and we know bruxism is a stress. Very wrong. When pressure increases, those receivers send the alarm to the central nervous system. Immediately, bruxisms. The body activates this mechanism in attempt to release the dental blockage. What they mean? We know central nervous system know the occlusion is blocking that position. The jaw cannot go to the right position. And what side? Proprioception, teeth proprioception, joint proprioception, bruxisms, destroy the teeth. Very bad defense. Sometimes nature is wrong, but it's the only one we have. And when we start the bruxisms, we increase the problem. No more vertical dimension loss, more increase in depression, etc., and starting a domino effect. Remember, danger here, destroy here. Unfortunately, this causes more damage because it's increasing the hyperactivity. Changing in the jaw position, increase depression, alarm, bruxisms. Very bad system. That is creating hyperactivity from the top to the bottom. Chronically, this will arrive to lumbar. Some lumbar problems are related with the jaw position. This is a message for also therapists, that they are treating the symptom, but they are not treating the cause. And the dentists don't know that, and we only work here and nothing more. That's very important to take always in front of us, this picture. Bruxisms, T.M.J's defense. These changes create a defense that is an irrational defense, but it's danger, and we have to defend the joints. And then chronically is creating a domino effect. And more chronically is the situation, chronic pain and injuries. Misconception, common misconception is bruxisms is caused by stress. Very wrong. Obviously, chronically, that situation is creating stress. But bruxisms is not stress. Why? Because stress is just put together the teeth and force. I am very hungry. I close my mouth. Bruxism is scrambling the teeth. This is not stress. This is trying to liberate the things we call in, I will talk that later regarding the functional areas. Liberating the functional areas of the teeth to make freedom to the joint. Obviously, chronically is creating stress, but it's creating postural pathology. That's why in our school we said you never have to treat only T.M.Js. You have to treat craniofacial system and the posture of the body, and for that you need an interdisciplinary treatment. Bruxisms causes stress, and the hyoid system is the connection between the upper part of the body and the lower part of the body. I show you one video. It's a very nice video. Look at the bone. The bone is nothing like this. We talk about hyoid. The hyoid is a bone, but the bone with the muscles is related with the jaw. Look at here. It's connected with the jaw, mid-hyoids, and the retrohyoid system with the neck. Anytime we change the position, and then the lower part of the hyoids is connecting with the clavicular. Anytime we change the position, we are affecting the system, and we are affecting the rest of the body. We are all connected. We are not just separated parts in the body. And the tongue is very important. Sometimes I see dentists, orthodontists that take out teeth to make alignment of the teeth, and they are closing the space for the tongue. The tongue change position. If the tongue change position, is affecting the hyoid, it's affecting the neck, and it's affecting the rest of the body. We have to pay attention when we treat the teeth. And look at here. This is a sample. The most dangerous situation is the retro position, and also if we lose the vertical dimension. Look at this situation, retro position, compressing the vital area, and to defend that area, bruxisms to destroy the teeth, and is creating hyperactivity. Muscle hyperactivity. Cranial muscle hyperactivity. Hyperactivity in the neck, and we create a block into the neck. And then slowly is going down if we leave that chronically. Retroposition is creating this situation, is creating the most bigger problem, big adaptative scoliosis. The muscles hyperactivity chronically is going down and is arriving to the foot. When we have a retroposition, we block first and second vertebra, atlantis. The lateral deviation is blocking the lower part of the colon. Look at that, another tips for diagnosis. Retroposition, upper block. Lateral deviation, lower block of the cervical colon. Some clinical cases. Just to not bore you, just to see some patient, okay? Look at here. The teeth, jaw position, adaptative scoliosis. This is not the real scoliosis. Most of the scoliosis are adaptative scoliosis. Here, also a patient with a shorter leg and jaw problem. In that age, we can prevent the situation. That's why we focus in the prevention. The craniofacial orthopedics is fundamental, because in that age you can prevent the future of the adult. Look at here. This is not the same patient. Yes, it's the same pattern of pathology. This child, if we leave it, will arrive like this when we'll be an adult. Prevention is goal. And look at here, mouth open, 0 kilo, when it's closing the mouth, 2 kilos. Anytime the jaw is not centrated, is increasing the problem, the overload. Same here. And look at the instability here. The instability of the varicella, the movements. And how we do the diagnosis? Second point. We do a very good craniofacial diagnosis and a postural diagnosis. For the craniofacial diagnosis, we do some topics, and the postural diagnosis, the posturometric and clinical posturology. With this, we have the whole picture. When we have the whole picture of the situation, when we have the whole picture of the situation, we can treat the patient. We will study in the craniofacial diagnosis the mandibular posture, the dental occlusion, and the neuromuscular activity of the oral corridor. That's very important. If this is in balance, craniofacial system is healthy. The balance, muscles, teeth, and mind. Jaw, very good centrated, protecting the disc and protecting the retroposition area. Look at that, it's a very good centration. Here, jaw, who is no centrated, and the occlusion is blocking the situation. Same here, retroposition and losing the vertical dimension. And look at here, that situation we can prevent, as I told you before, and that is a situation that we can prevent during the growth age. Look at that. We're making here the deprogramming of the jaw. Yeah? And with this jaw deprogramming, is going to the right position. During the growth, you can change that position. Very, very good. Now you have to only treat it. Now we have to see something about the occlusion analysis. Obviously, this is not a course, but just to show you some topic. Yes, okay. We have to see the occlusal plane. We have parameters, because if the occlusal plane is good, the jaw is good. If the occlusal plane is inclinated like this, forward or back, the jaw is following that plane and is changing the position. That's why it's very important. The orientation of the occlusal plane. Bipolar plane, parallel in the front, and camper plane, that is tragus nose. A good anterior guide, we call that the anterior guide, that is protecting the joint when we have propulsion of the jaw. Good occlusion means health for the craniofacial system and a good balance in the neuromuscular system. That's very important, because the imbalance in the oral corridor is creating the problem. Oxygenators, lips, chin, tongue, breathing. If all is good, the child will grow good and the adult will be good. Even in the adult, we have to do exercises for muscles. And we only treat the teeth normally. We have to do exercises for oxygenators, to lips, tongue position, breathing. All this is creating this area in a good balance, and then we will have a good postural health. This situation you can prevent during the growth. The chin hyperactivity during the growth was creating retroposition of the jaw and is changing the growth of this jaw. Now, this patient have a problem. During the growth age, you can prevent it. I will show you later some patients. And then the diagnosis. We studied the postural planes, the thoracic brachial triangle, the rotation test, the convergent test, the differential test, the march test, this foot support. Obviously, in this webinar, I cannot teach all the postural diagnosis, but this is the diagnosis we do. This picture, very simple. When we saw this inclination, we believe we have two receptors affected, and we see these two parallels. We have one upper or one lower. That's very important for diagnosis. When we see that situation, the thoracic brachial triangle is not asymmetric, we think this patient have a real or false short leg. And that's very important. Rotation and flexion. When we have limitation here, we have hyperactivity in the lower part of the cervical column. And that is connected with lateral deviation. Look at the imagine. For the people who is rehabilitator people, the jaw creating problem in the neck. And you are treating the neck and you are treating the jaw position. And here, when we have flexion and extension limitation, is because first and second vertebra have in that area hyperactivity and block related with forward position and retro position. Imagine how the position of the jaw is affecting the neck. You cannot treat only the neck, only the jaw. Hypoconvergence to see the test. The differential test. Why? Because if we have an hypoconvergence, it's very difficult to explain in 2 seconds the neurophysiology, but the both eyes are connected with the nuclear perula, which is connected the movement of the eyes. But it's working only in the binocular vision. When I close one eye, it's annulating the nuclear perula. And if repeat the convergent test and the eyes is moving, that means the problem is peripheral and is connected with the jaw. Another tip for diagnosis. The March test is to test the muscle change. It's a test that we do with open mouth and mouth closed, and we see how the patient moves. When the patient moves to the right, is because of hyperactivity on the left. And if moving to the left, hyperactivity on the right. And if moving forward, hyperactivity on the back. Connected with the occlusion also. The shoes, how they are, and then the posturometry. The posturometry is a diagnosis we do with an instrument, but this is a posturometer. No? If I told you that picture, what happened, what they are in common, the search of the center of gravity. The search of the center of gravity. That's, we are looking every second, our brain, to put our body closer to the center of gravity. Why? You think why? Because we use less energy. Brain is lazy. They want to use less energy. And that's why it's making adaptation, scoliosis, to bring the body to the center of gravity. Scoliosis is not a disease. Only the real scoliosis, when the colon is bigger than the body. This is an anatomical problem and have to adapt into the body. 5% of the patient, 90% is relating with the thing we are talking about. And you cannot treat the scoliosis if you are not looking craniofacial system, foot support, biochemistry. We are not talking about biochemistry here, and the whole diagnosis. Less energy in the position closer to the center of gravity. The posturometer is measuring with the concept of Capagni. It's very difficult in very short time to explain the whole concept of the posturometer, but I want to try it. I will try to be clear. Capagni studied the body weight distribution into the floor in a percent, in the first metatarsal, fifth metatarsals, and calcaneus. This posturometer is analyzing this body weight distribution. And reading missions, and we have a protocol to make the diagnosis. The instrument without protocol is nothing. The same is the protocol without instrument. Both are parallel. The posturometer help us to do a good diagnosis, to plan a treatment, and to follow a treatment. Just not clinical. The sensors, this posturometer has sensors in the areas of Capagni, take the measure. And another research I did many years ago, 1989, I tried to measure what happened when we create pre-contacts in the teeth. And we measure. We put little composite creating pre-contact to see when the jaw moves for the pre-contact and what happened with the foot supports. And always, I was very surprised because anytime we put pre-contacts, they alter, depending on the area, the first metatarsals, the fifth metatarsals, and the calcaneus. For the posturometer, we do a test, a very simple test. Look at here, very simple. Here is normal when the triangle is 3. Red with the point forward is more than the load, and this one is less. And look at, anytime we created pre-contact in the area of the incisors and canines, we observe the patient lose load into the first metatarsus of the same side. When the pre-contact was into the molars area and premolars, lose load into the fifth metatarsus. And when we have pre-contacts on the back of the teeth, we have less load into the calcaneus. Imagine pre-contacts into the teeth, change the jaw position, affect the foot. Chronically, we will have a foot problem. Anterior teeth, third metatarsus. Molars, fifth metatarsus. Posterior teeth, calcaneus. In another point of view, this area, pre-contacts here, alter the first metatarsus. This area alter the fifth metatarsus. This area alter the calcaneus. Imagine. Jaw, teeth affecting the foot. That's why we said we cannot say T.M.Js. T.M.Js and posterior. Craniofacial system and posterior. Treatment. How we treat it? In our school we said the first thing we have to do is deprogramming the jaw. I invented roughly 20 years ago a dispositive. I call the dispositive bed because it's not a biplane. It's body equilibrium device. Device for the equilibrium of the body. It's a thermoplastic device for all medical sciences. When we use the bed, we are annulating. The deprogramming is the most important thing because we are taking the momentarily, we are taking the aggression of the craniofacial system, and that's allow the muscle change relax and allows the specialist to work and treat the patient in rehabilitation. Imagine an osteopath, a physiotherapist that can do a rehabilitation without interferences of the craniofacial system through the muscle change. That's the goal, deprogramming. Bed is a simple device, one size that you can adapt for any patient. Always we use that also in child for orthopedic purpose. One measure for everybody. You can adapt it. Look at here, before and after. We functionalize, and after a week, we can do any treatment in the body without pain. Have different parts, the anterior guide shield, any part is functional stable, and any part, this is not a case for bed, but just to show you bed, no? It's any part, and the shape of this device is very important to annulate the aggression of the craniofacial system, and the use of the bed, primarily during the night, but also for sportive, when you do exercises, when you have stress, exaggerated stress, long trips, and this is the bed. And I show you in a video how is the adaptation. Look at the bed is very simple. You need hot water, not more. The first step is to put the bed in the hot water, and then you leave it for not more than 2 minutes. Very easy to adapt. You don't need impression of the teeth, nothing. You do in the mouth of the patient. And then after that, you see if it's plastic like this, you enlarge. The first thing is enlarge the bed. Look at how it's changed the situation. And then when it's large enough, you go to the patient, you stay on the back, and you make the position of the bed. You put the fingers on the palate and the others in the front, and you are creating the adaptation slowly of the bed device. Very simple. You need a training, obviously, but it's very simple. The training is, we do the training online. It's very simple. And look at it. You are creating the anterior guide. Then you put in the cold water, because that have memory. And then you test it. And then when you test it with this good adaptation, say the patient to close their mouth, you check if the occlusion is good, right? And then you check in that, and then you are seeing if the teeth touch together in one side and in the other side, right? And then you have to check if it's arriving to the last teeth in the mouth, the last teeth in the arch. That's very important to see if we are in the last teeth in the mouth, in the last teeth in the mouth. And then, when is checking that, if it's not arrived, you can enlarge the device. You put one part only in a very hot water, you leave it for longer, and then you can enlarge. You see that? And then you perform the curve of the split. Okay, and look at how it's enlarging, how it's changing the shape. We create a perfect material there. The cold water, and then you go to check if it's enough. And then, after that, the other side. You do the same procedure. Leave it and enlarge. Right, that's good. Look at how it's changing the shape. And then you check again. Cold water, because the material have memory. Hot water, and then you go and test. If it's going on the back, you close, and you say to the patient, you check if the guide is good, if it's a good space in the frontal teeth, and they move right and left, forward and back, and we're doing the functionalization into the mouth of the patient. Very easy. The bed move. The bed is not fitted into the teeth because have to protect the cranio-sacral breathing. And the patient is free, the bed move, is not blocked. And this is our osteopath testing the neck. If the neck is good, relaxing immediately the muscles, the bed. It's very quick. When it's relaxed, you do the test, the rotation test. You do the other test, and then up and down. Sorry. My mouse. My mouse is quicker than me. Okay, that's it. The rotation test, flexion, extension is free. Convergent test. Normally, when it's good adaptation, it's correction immediately. The convergence. And the march test. They don't have to move right or left, just 10 steps. Very easy to adapt. This is some clinical case. Look at here. Very bad situation, and the reading. 4 kilos before, after bed, 0. Another tool we have for T.M.Js is the reprogramming. After deprogramming, we have to find the right position of the jaw, the vertical dimension, and the jaw position centrated. We have the reprogrammer and we have microplanes to reprogram the jaw. We call that the reprogrammation of the jaw position. Progressive mandibular reprogramming, founding the vertical dimension and the jaw position. Progressive mandibular reprogramming. Reprogrammer, only nighttime use, allow us to create in a chronic patient's disease to found the vertical dimension. The microplanes is quick for prosthetic reasons or orthodontic reasons. This is the reprogrammer. We put in an articulator and then we create it. This patient was a patient that the surgeon wanted to operate it. And that was the situation before and after reprogramming. I said to him, before do the operation, why we don't try? And we tried with the reprogrammer and it was fantastic. From this to this. Now, we need a simple orthodontic treatment, no surgery. Microplanes. We test the height and we create little planes to find the jaw position. Two different tools. And the prevention, this is the more important things in the childs who they are growing, the craniofacial orthopedics. This is the goal. In that age, we can prevent the future. That's very, very important. When we have a situation like this, we can prevent the future of the patient. Growth age, craniofacial orthopedics. This is the regulator. It's another device I invented more than 40 years ago to stimulate the growth during the growing age and guide the growth. And look at the cases, how they change. How stimulating the growth, and when you create a good neuromuscular balance, the teeth go in good alignment. Look at the changes of the patients. And this, how change the face and the teeth. These cases is not orthodontics. They need orthodontics. It's very simple. Open bite. The growth, stimulating the growth in the growing age. That's very important. How they change in that age is prevention. We do treatment with physiotherapists and osteopath and craniofacial orthopedics. Interdisciplinary treatment. Look at how the child change. They change a lot during the growth. Change a lot. 6 years old. Look at how it's changing. The face and the teeth. Look at that. But the most important thing, the posture. How the posture is changed. That's the prevention, starting at 6 years old. Growth. Look at from here to here the difference. The face changing. This is prevention. And the teeth are changing. And look at that. The posture, that's important. Started like this, finish like this. Look at the torsion, how it's changed. Look at. It's very important to understand that all the body is connected. All the body is connected. Okay, for the webinar, I think it's enough today. This is our courses. If you want to study with us, this is Silverson Company, and we have our app that we connect with everybody. We have the fundamental curves of NPR, T.M.J's and postures, cephalometric, growth diagonal, posturometric, orthopedic. We have a lot of courses, a lot of cases in our application. If you go and visit that, you can see what happened. So if you have question, you can write the question because it's better. You can write the question, and if it's important, this webinar will be recorded, and I will share the link of our application. Let me 1 second. If you want to go to our application, this is the link of the application. You will see this webinar recorder. You will see there to review if you want. You can register in the app. Is free, like a visitor, and you can see all there in the future. Okay. If you have any questions, just write a question. If it's not, okay, we go to relax. I hope that you enjoy the webinar. I hope you enjoy it, and I hope you stay with us in the future webinar. We will do webinar like this for the people, and I hope I see a lot of you, and I see a lot of you in our application. Thank you so much to be here, and if you go to our app, we can share more in the app and in our YouTube channel, etc., etc. Thank you so much. I'm very happy you enjoy the webinar. Okay, and I hope I will see a lot of you in the next webinar. We'll do informative webinar for different topics. Okay, take care, everybody. Enjoy the rest of the day, and we will be in touch in our socials. If you go to our page, obviously, I put in here. On there, you can navigate for all our socials in the. Let me put the web page here. I write it for you. Wait a minute. This is therocasilverio.com. If you go there, you go clicking there, you will see a lot of information there, and you can navigate for everybody from the app, YouTube channel, social pages, etc., etc. Follow us, and you will have a lot of information like this in the future. Thank you so much to be here, and I hope I see you in the next webinar. Bye bye, everybody. Bye bye.